Welcome to this explainer. Today, we're exploring something absolutely fascinating, the pharmacology of the peripheral nervous system. Think of your body like a hyper-advanced spaceship. While you're busy navigating your conscious thoughts and actions, there's this ultimate automated control panel running entirely in the background. It manages your heart rate, digestion, blood pressure. Actually, scratch that. It manages basically everything, all without a single conscious thought from you. We call this the autonomic nervous system, or ANS. And today, we're going to learn exactly how scientists have figured out how to chemically hack this autopilot.
Okay, let's dive into this. Here is our roadmap for untangling all this. We're going to cover 1. The body's autopilot system. 2. Keys to the system. 3. Hacking rest and digest. 4. Hacking fight or flight. 5. Controlling muscles and pain. And finally, 6. Real-world applications. Let's jump right in.
Kicking things off with Section 1. The body's autopilot system, sympathetic versus parasympathetic.
So before we can even talk about the drugs, we really have to understand the battlefield. Our involuntary functions are constantly being pulled in two totally opposite directions by two distinct divisions of the nervous system. Over on one side, we have the sympathetic nervous system. This is your fight or flight mode. It originates from the thoracolumbar region of your spine, and it primarily relies on the neurotransmitter noradrenaline. On the flip side, we have the parasympathetic nervous system. This is your rest and digest mode. That one flows from the craniosacral region and relies on a completely different chemical messenger, acetylcholine. Essentially, every single drug we discuss today is a tool designed to tip the scale toward one of these two sides.
Because these two systems represent completely opposing survival states, their effects are highly predictable. Just think about it. If a drug hacks your sympathetic fight or flight system, it's basically preparing you to run from a bear. So of course, it's going to increase your heart rate, dilate your pupils so you can see better, and open up your airways, bronchodilation, so you can breathe. Conversely, if a drug activates your parasympathetic rest and digest system, it's going to do the exact opposite. It'll decrease your heart rate, constrict your pupils, and really ramp up your digestion.
Moving on to Section 2, Keys to the System, Neurohumoral Transmission.
If the nervous system is a control panel, neurotransmitters are the specific keys that turn the machines on and off. We call this neurohumoral transmission. This chemical messaging doesn't just happen by magic. It follows 6 very manageable steps. First, the neurotransmitter is synthesized. Then it's stored away in little vesicles inside the nerve. When a nerve impulse arrives, the transmitter is released into the gap. It then binds to specific receptors on the target organ, generates a biological response, and finally is removed, either by degradation or reuptake, so the signal stops. The drugs we're about to look at, they are designed to intercept this exact process.
Now, if neurotransmitters are the keys, receptors are the locks. Acetylcholine unlocks cholinergic receptors, which come in 2 main flavors: muscarinic, which you'll find in smooth muscles and glands, and nicotinic, found in ganglia and neuromuscular junctions. On the other side of things, adrenaline and noradrenaline unlock adrenergic receptors. Those are split into alpha receptors, which generally handle stuff like vasoconstriction, and beta receptors, which manage heart activity and bronchodilation.
All right, Section 3. Hacking rest and digest with cholinergic drugs.
Now we get to the actual pharmacology. Let's introduce our first group of hackers, the drugs specifically designed to manipulate the cholinergic receptors of the parasympathetic system. First up, the parasympathetomimetics. Think of the suffix mimetic like a mime or a mimic. These are basically duplicate keys made in a lab to perfectly fit and activate the body's natural rest and digest locks. They stimulate the cholinergic receptors just exactly like acetylcholine would.
Notice how logically the adverse effects mirror the intended actions here. Drugs like pilocarpine, which acts directly, or neostigmine, which acts indirectly, cause bradycardia, that's a slower heart rate, and increased GI motility. Because it ramps up rest and digest, of course the side effects include excessive sweating, excessive salivation, and diarrhea. Your body is just in total overdrive trying to secrete and digest. But on the flip side, we have parasympatholytics, often called anticholinergics. If mimetics are duplicate keys, lytics are like broken keys jammed firmly into the lock. They don't turn the machine on, they just sit there, physically blocking the natural acetylcholine from binding, which completely shuts down those rest and digest signals.
So the crucial point here is that when you use a blocker like atropine or ipratropium, you dry the system out. These are incredibly useful for treating asthma or motion sickness. And atropine, it is an absolute lifesaver for organophosphate poisoning. But predictably, because you're blocking rest, digest, and secretion,
The patient is often left dealing with dry mouth, blurred vision, urinary retention, and constipation.
Let's head back across the battlefield for Section 4, Hacking, Fight or Flight, Adrenergic Drugs.
This is where the stakes get intensely high. We're talking artificial adrenaline, severe blood pressure changes, and treating clinical shock. Just like our last group, we start with the mimetics. Sympathomimetics are drugs that stimulate adrenergic receptors. These are the ultimate fight-or-flight duplicate keys, chemically designed to rev up your body's survival engines to maximum capacity.
Drugs in this class include adrenaline, salbutamol, which is super common in asthma inhalers, and amphetamines. Their actions are dramatic, right? They spike blood pressure, increase heart rate, and force your airways open. They are literal lifesavers in cases of cardiac arrest and anaphylactic shock. But the natural cost of pumping the body with artificial adrenaline is that your adverse effects will naturally include severe anxiety, tremors, tachycardia, and dangerous hypertension.
To counter that, we have sympatholytics. These are the drugs that put the heavy brakes on your fight-or-flight system, effectively jamming the adrenaline locks so that your heart and blood vessels don't overwork themselves.
You've likely heard of these in everyday life. We have alpha blockers, like prazosin, and beta blockers, like propranolol and atenolol. Because they block the receptors that cause the heart to pound and blood vessels to constrict, they are logically perfect for treating high blood pressure, angina, and irregular heartbeats. But by suppressing that sympathetic energy, they simultaneously carry the risk of fatigue, dangerously slow heart rates, and low blood pressure.
Which brings us to Section 5, Controlling Muscles and Pain, the Outliers.
Let's step slightly outside the automated internal organs here. Pharmacology also allows us to hack skeletal muscles and block localized pain signals. Let's look at these outliers. When it comes to muscle control, we have two very different tools. First, neuromuscular blockers like succinylcholine. These literally paralyze the muscle by blocking transmission at the junction, which is absolutely crucial during surgeries or when intubating a patient. On the other hand, we have skeletal muscle relaxants like dantrolene and baclofen. These don't paralyze, they simply reduce painful muscle contractions and spasticity, making them life-changing for conditions like cerebral palsy.
And what about pain? Local anesthetics like lidocaine have an incredibly clever mechanism. They don't just numb tissue, they reversibly block voltage-gated sodium channels. By plugging these channels, they quite literally pull the plug on nerve conduction, stopping the pain signal from ever traveling up the nerve and reaching the brain in the first place.
Finally, Section 6, Real-World Medical Applications.
You know, it's deeply satisfying to ground all of this dense pharmacological theory into highly practical clinical solutions. Let's look at a couple of major diseases. Consider this. How do we treat severe system malfunctions like myasthenia gravis, which is an autoimmune disease causing profound muscle weakness, or glaucoma, where increased intraocular pressure slowly damages the optic nerve? Using our new knowledge of mimetics and lytics, how do we solve these actual diseases?
Well, the solutions are actually really elegant. For myasthenia gravis, the muscles aren't getting enough signal, so we use an anticholinesterase, like neostigmine. This prevents the breakdown of acetylcholine, flooding the neuromuscular junction with the messenger to restore muscle strength. Problem solved. For glaucoma, we need to reduce eye pressure. We can use a cholinergic drug like pilocarpine to increase fluid drainage, or a beta blocker like timolol to reduce the formation of that fluid. We're perfectly fixing the broken mechanics of the condition.
To wrap the whole shebang up, here is your ultimate study guide table combining everything we've learned today about the peripheral nervous system. We've seen how scientists have engineered molecules to perfectly mimic or block our most vital internal signals, giving us control over everything from our heart rate to pain perception. It leaves us with a truly awe-inspiring thought. If we can master the body's complex autopilot today, what other cellular locks might we discover the keys to tomorrow? Thanks for joining me on this explainer, and keep learning.